Welcome to the Adult Immunization Series on measles as a vaccine-preventable disease. The Philippine Guidelines on Periodic Health Examination, section on immunization for adults, targets specialists, general practitioners, and allied health professionals. Evidence summaries are based on the best available scientific evidence at the time of formulation. Systemic synthesis of evidence was used to address immunization in adults, and best available evidence was appraised on identified clinical questions. The GRADE approach, evidence to detection framework criteria, was used. This table shows the basis for assessment of quality of evidence using the GRADE approach. Measles is a vaccine-preventable disease. This is the recommendation from the Philippine Guidelines on Periodic Health Examination for measles-containing vaccine. Despite very low certainty of evidence, the panel strongly recommends the giving of measles-containing vaccine to healthy, non-pregnant, and unvaccinated adults. No recommendation was formulated for giving of measles-containing vaccine for healthcare workers. Studies on efficacy of measles vaccine among healthy adults are lacking. The evidence base used indirect data from pediatric population and included studies where 2 doses of measles-containing vaccine were administered to participants. This may have applicability issues since 1 dose is sufficient to confer lifelong immunity among healthy adults. 2-dose regimen is suggested only for high-risk groups. Evidence on the cost-effectiveness of measles-containing vaccines came from simulated or hypothetical birth cohorts. Surveillance by DOH showed low rates of fully immunized children, recording only 60% in 2020, causing an expected increase in the population of measles-susceptible individuals. Despite very low certainty of evidence, the panel were unanimous in recommending measles vaccine to unimmunized healthy adults, due to the airborne transmission of measles, thereby having a highly infectious nature, the high morbidity and mortality rates associated with it, and also the expected increase of adult population susceptible to measles secondary to the current low vaccination rates. Measles is a highly contagious acute infection characterized by fever, cough, coryza, conjunctivitis, rash, and enanthem, that may lead to severe complications, including encephalitis. In 2019, Philippine data showed that there were 2.31 deaths per 100,000 cases of measles. A surveillance report of the Department of Health issued in July 2019 reported 208% higher number of measles cases compared to the same period in 2018. There were 538 deaths out of 39,856 measles cases, translating to a case fatality rate of 1.3%. Age ranged from less than 1 month to 88 years old. Age groups with the greatest number of cases were 1 to 4 years old, 6 to 8 months old, and less than 6 months old. Majority of these cases were not vaccinated. Adults with measles are at increased risk for mortality compared to older children, and measles in pregnancy is associated with premature labor and spontaneous abortion. Measles vaccine usually offers long-term immunity, but antibody titers have been shown to decrease over time. Anamnestic response to revaccination of those with waning antibody titers after primary vaccination suggests continued immunity. Randomized control trials investigating the effect of measles-containing vaccines in an otherwise healthy adult population are limited, as most of the literature involved pediatric populations. 9 observational studies showed that giving 2 doses of measles-containing vaccine compared with no vaccination yielded an overall median vaccine efficacy of 94.1%. Studies showed that giving 2-dose measles-containing vaccine significantly reduced measles incidence compared to no vaccination. The 8 total studies analyzed in 2 systemic reviews found that the measles seroconversion rates for ages 7 years old and above ranged from 96 to 100%. MMR vaccine is still immunogenic for measles even if given outside the recommended age. Reported adverse reactions for MMR vaccine include fever, rash, lymphadenopathy, joint complaints, hypersensitivity reaction, development of immune thrombocytopenia, and seizures. Overall, this study suggests that the MMR vaccine is safe and well tolerated by recipients 7 years old and above. No serious adverse events were documented in the studies included in the review. Data from indirect studies showed that the receipt of standard titer MCV was associated with reduction in all-cause mortality from 4 clinical trials. Measles outbreak in hospital settings are driven by factors such as low measles-containing vaccine coverage among health human resource, low knowledge about measles, delay in measles hospital case reporting, and lack of proper measles case management. Strict use of alcohol-based hand sanitizer and rapid isolation are both insufficient measures to prevent measles outbreak in a hospital setting. Vaccination is the only reliable means to prevent nosocomial measles infection. In low-resource settings, nosocomial measles infection can be reduced through a mandatory 2-dose measles immunization of all healthcare workers. The immunization status of healthcare workers should be documented. Economic analysis of the current measles vaccination program in East China and in USA concluded that the national 2-dose MMR vaccination program is highly cost-beneficial and results in substantial cost savings compared with the absence of the program. Before the development and availability of measles vaccine in the 1960s, outbreaks of measles occurred predictably every year in the United States and other temperate regions. In 2019, measles outbreaks have persisted in the USA and globally with over 400,000 confirmed cases, reflecting an overturn of decades of progress towards measles elimination in many countries. Vaccine hesitancy is one of the contributors to low vaccination coverage in both developed and developing countries. Determinants of measles vaccine hesitancy were identified as follows: contextual influences, individual and group influences including beliefs and attitudes of parents about health and prevention, past experiences in vaccination, lack of knowledge and awareness, perception of lack of risk, and low benefit of vaccination among guardians. Vaccine and vaccination-specific factors such as vaccination program, schedules and mode of delivery, role of healthcare professional. In the Philippines, DOH declared measles outbreak in 5 regions with a nearly 8-fold increase in the number of cases since 2018. There had been a decline in the first dose of vaccine in the past decade from above 80% in 2008 to below 70% in 2017. Initial figures for 2018 indicate further decrease, leading to more children becoming susceptible to measles infection. WHO estimated that at least 2.6 million Filipino children under 5 years are not protected from measles. Factors identified that contributed to the low immunization coverage in the Philippines include inadequacy of service delivery, limited immunization sessions at primary care level, accessibility issues in hard-to-reach areas, and decreased vaccine confidence. In summary, there are 1 local and 3 international guidelines that recommend measles-containing vaccination among adults. The Philippine Society for Microbiology and Infectious Diseases recommends giving 1 dose MMR vaccine for immunocompetent adults. If as post-exposure prophylaxis, 1 dose should be given within 72 hours after exposure. The Australian Immunization Handbook in 2021 recommends giving 2 doses for adolescents and adults born during or since 1966 as catch-up vaccination or if with unknown history. WHO routine immunization of 2020 indicates that 2 doses of measles-containing vaccine are more effective than 1 dose in protecting against measles. The USA ACIP 2013 recommends giving up to 2 doses if with unknown history of prior infection. For healthcare workers, child educators and carers, people working in long-term care facilities and in correctional facilities, travelers, 2 doses are recommended. These are the list of references. Thank you for joining us in this series.